Yay, welcome. Good morning, everybody. Welcome to the last Pediatric Grand Rounds of 2023. We're so happy for the people that are in the room and also all of you that are on WebEx today. And today I have the pleasure of introducing all of our boss, Dr. Leslie Walker Harding, who is the Ford Morgan Endowed Chair and Professor of the Department of Pediatrics, as well as the Associate Dean for the University of Washington. In addition, she's the Chief Academic Officer and Senior Vice President for Seattle Children's Hospital. She has been dedicated to the health and well-being of children and adolescents for over 25 years, particularly in the area of prevention of adolescent substance use and promotion of healthy adolescent development. Her current focus is to raise awareness of and bring to national scale proven interventions to prevent the development of substance use and mental health condition in children and adolescents. We're so happy to have you here at the end of the year. Welcome, Dr. Leslie Walker Harding. Thank you.
Great. Good morning, everyone, and thank you. And thank you for those few of you that are here today in person. It makes it feel like a real talk, so thanks. And I see a number of you are online, so thank you too. And please, I will try to talk so that there is time for some questions at the end, but I know sometimes that in the effort to try to talk about our amazing department, it ends up going a little long, so I will get started. You know, whenever you start a talk like this, you want to kind of set the tone with a preamble, and it actually was pretty difficult to think about. That was actually harder than putting the whole talk together, to think about how I could begin this and really set the tone for the talk I'm giving this morning. You know, we've experienced such consequential milestones and events over the last year, both directly in the department, with one in the department being the passing of a beacon of an era with Dr. Abe Bergman's passing last month. He was so impactful to not just our department, but to the country, and many of the public health changes that he brought about, like flame retardant, having flame retardant clothes for kids developed, as well as SIDS, really grounding that, as well as helping to develop Odessa Brown with the community in many years past. He was a Renaissance person, and it's the passing of an era. So we saw that. We have noticed, even beyond the department, our health systems have been what I would call buckling and fighting to survive financially with a lot of unexpected things, as well as our systems and our health systems being resistant to change for many decades that probably could have prevented some of this. So now our health systems are really working hard to reimagine what it means to be a successful healthcare organization. We've just heard the approval of the FDA of a cure for sickle cell. I mean, that's again, we've had some really amazing breakthroughs with healthcare and research that are going to directly impact our children. We've also had national, global strife, war, atrocities committed in those wars. And that's in the backdrop of our country going through a lot of political challenges with the upcoming election. There are so many things that are going on. Our world is shifting and changing, and there's so many things that could pull us apart and make it difficult for us to work together. And yet, I have been so amazed and really watching our department try to live up to our mission and our vision of being collaborative and unified and working together in the cause to really improve the health and well-being of children, to train people to be the best pediatricians and researchers and healthcare people that they can be, and to deliver the best care that we can give. We continue to strive and move beyond that, and our department is just phenomenal. And I am very humbled and very grateful and appreciative of all the work that everybody's done, because what has happened is, you are the department. This is a human organism, and our human organism is amazing in how we have tried to navigate so many things that people will look back 20, 30, 40 years, look back in our era, because there's so many things happening that it's not going to be the same moving forward. And we're right at that crux. And I really salute you and acknowledge how much work it's taken and how much determination and fortitude and belief in the dream and the hope that we can actually deliver the best care possible for kids. So I just wanted to take a moment and say thank you. In the midst of everything, it is quite amazing, the determination and the success people have had working through and continuing to deliver on our mission. So thank you. So let me begin. And as you know, we always like to start out with our acknowledgement. And it just makes sure, I think the most important thing to me when we have this acknowledgement is that it doesn't take the place of authentic relationships with Indigenous communities. But, you know, it does serve to honor the land that we're on and to say that as UW Pediatrics, we recognize the traditional unceded lands of the many Indigenous communities and tribes our facilities occupy across the WWAMI region. UW Pediatrics honors with deep gratitude the land itself and the people and tribes, past and present, who have called and call this land home. I would also like to, once again, I think once a year it's really important to continue to keep alive our true Northwest, you know, where we're trying to go with our mission and our vision. So through excellence, innovation, and collaboration, we will improve the health of all children and adolescents and reduce inequities by educating the pediatric and physician leaders of the future, advancing research, advocating for children, and providing the nation's best primary and specialty pediatric clinical care. In partnership with our healthcare and academic institutions, we are committed to a diverse and inclusive department in which faculty, staff, and trainees can reach their personal and professional goals in a collegial environment. I feel this is still alive and it's still relevant as we go about our work. And again, I think one of the most important things for us in this coming year is to remain focused on being unified and collaborative. And through that, we're going to be a vibrant department, and we will continue to be able to rejuvenate and find that energy to keep us going when things might be challenging. And so let's start out with just a recap of who the executive committee is within pediatrics. We have, I think, one new face. Dr. Luke Hoffman is our, within the last year, has been named the Vice Chair of Research. And I did also want to highlight that Dr. Susan Marshall will be stepping down as Vice Chair of Education. She is still going to be here with us and working very closely in GME leadership, but she will be stepping down from the Vice Chair position, and internal search and interviews are already on the way for her successor. And I think everybody else you have seen and are still working very diligently. What each of the vice chairs has done in part of the talk is you'll see there are, as we work on our 2024 strategic planning, they have put in some of the areas and things they've done and what within their area of responsibility they put in what they're working on and what we're working on through them. And then our executive council, again, I think this is working out really well in having the areas that we really work under within clinical affairs, EDI, research, finance, faculty affairs, administration, and education. We have paired our administrative leaders with our academic leaders, and I think that's been working out really well. One change here will be Dr. Sabrine Akhter is going to be, I need to get the title, she is moving to be Director of Medical Student, the CUSP Pathway Community Forward Urban Scholars Program at the medical school, which is a wonderful responsibility that she's going to have. And so because of that, she is stepping down as the leader of our JEDI committee, Justice, Education, Diversity, Inclusion. And so we will be soon looking for, doing an internal search for a new leader. So if you're listening and you've been secretly waiting and hoping for this opportunity, please, please email and let me know. But we're going to formally put out a call. Let's see. And some of our new hires, people who are coming new to the department, we're very excited to have Maria Zontin, who's our Associate Director of People and Workforce, a new position that is quite amazing. She just stepped in day 2 and had really had to quell a people and workforce issue, which she did with quite wonderful expertise, and we really have enjoyed having her here. Elizabeth Kolesa is our new payroll finance manager. It's a new role, and we're really excited to have her because as we continue, as you'll see, we continue to grow and payroll becomes extremely complex. We needed somebody who was really going to sit on that and work on that specifically. And you'll notice, I'll say this now because I'm thinking about it. You'll notice when I show you our statistics that we have increased the number of people who are in our administration and really kind of revamped and recrafted what we have. And that's a result of some work that Erin Allen did about 4.5 years ago with really doing a full assessment and external assessment of our administrative workings and, with recommendations on how we could really optimize that. And as a result of that, we have an amazing team right now that is really well poised to help us with the challenges we have as well as help us move forward. And hopefully many of you have met Dr. Jai Maswe. He is our new CICU division head in our new CICU division. And we are ecstatic that he has joined us as our new leader, and he is already deeply working very closely with the whole cardiovascular leadership team. And within, we've had some new people they're not new people, they're in new positions permanently. So Yolanda Evans was interim division head for adolescent medicine, and she has been made the permanent head. Same with Dr. Jen Kett, who is head of bioethics and palliative care, and Dr. Doug Opel, who is the director of Truman Catt Center for Pediatric Bioethics. And our new section of clinical informatics really kicked off this year with a number of people that are affiliating in this section, and that's being led by Dr. Michael Liu. Some leadership changes in graduate medical education. Troy Johnston has been just phenomenal as our interim residency program director, I'm sure. Yes. You would not know that he was a clinician in cardiology. He works so hard. I know he's hoping to go back to some of that work that he loves to do as well. But he has been fantastic with us, and he allowed us really to have the time to find and recruit our top choice for the residency program director position, and we were ecstatic when Dr. Alyssa Darden accepted, and she will be joining us with the new residency crew. She, instead of kind of having some body change mid-year for our residents, she'll start with the new group of interns in July, and so we look forward to seeing her. We also had an internal call for residency associate program directors, and Dr. Jarrett Scarlett and Dr. Hannah Dimming were selected, and we're excited to have them in these roles too as well. So there are a number of ongoing searches. Some of them I put down there in the Seattle Children's SCRI, but it's highly likely that they will continue to be pediatric faculty, so we are involved with these searches. Two of them I am hoping are very close to being near the end of negotiations, and one is the Health Equity Institute. We are working with somebody who will be our senior advisor to that, and we're real excited about that person. Hopefully that will be done before the end of the year, as well as neonatology. Those are very close. Nephrology is just kicking off. And the division head is just kicking off, and the vice chair of education is in interview stage, and the call for people who are interested in being pediatrician in chief at Seattle Children's, again, a position that would sit within the department but works at the hospital. That call, I think, closes tomorrow. So these are some ongoing searches that we have, formal searches. I know Dr. Jason Dean has talked about the Center for Indigenous Health, which sits within our department, and that's new to us. And as he has spoken, we are at the RR wing renovating a space so that the students, and not just pediatrics, but all across the School of Medicine, the students, pre-students, faculty have a space that they can call home and center on. So that work is going on. And if you haven't been over to our wing since it's been renovated, you really should go over and see it. It's beautiful drop-in space, little, some reasonable conference space for meetings as well. And CHDD, which is the Center on Human Development and Disability, which is now IHDD, the Institute on Human Development and Disability, was sitting in the provost's office. That now sits within the Department of Pediatrics, and we are in the process of transitioning that. Dr. Sunny Jewell has taken over as leader for that center. So those are two new areas that, again, the reorganization of our administrative staff was actually instrumental in being able to pull these quite large programs into our department. So the stats, let me see here. I think last year our total faculty was 1,211, so we continue to increase in every area, affiliates, CUMG, and PhD. Our advanced nurse practitioners is about the same. The administrative staff has, again, as I mentioned, increased over the last year. And we doubled the number of appointments. Last year we had about 54. This year we had 105. And that's a lot of work in our faculty affairs department, and they've been able to do that quite well. And then we also completed a number of research recruitments over the last year. Some of them we have just talked about, and that's been quite exciting as well. Now, if you look at money, that's the big changes, and there's a lot of stress and concern around how we're changing with now being PSA funded instead of really back funded by the hospital when we have deficits. What I will say about that is I'm very excited that we are moving to this because it gives us our own autonomy to make decisions about what is best and how we can best manage our department and our clinical work. And, it makes us more of an even partner with the hospital rather than having to go and say, well, you asked us to do this, now we're in deficit. We can say, well, let's talk together about how we're going to do some program or change things. It's not going to be easy the next couple of years as we do this transition, but it will yield us to be in a much more solid place. So, if you look at where we are now, our budget has increased. Last year, the total expenses was about $175 million. We've gone to $220 million with the increases in people, programming. And the other thing I would bring up when you look at grants, Children's managed grants and UW managed grants, in the small little letters you might not be able to see, this isn't all of the grant funding. This is the grant funding that is dedicated to FTE and faculty effort. And so as you'll see in the next slide, we've increased the amount of grants we have increased in the budget, the amount of FTE that is funded by grants going to faculty. And so, what we're hoping to do is with the change in RVU requirements and looking at existing clinical effort, we are trying to really, and this is not trying, we're going to do this, to minimize how often faculty are asked to work in extra outpatient clinics. So really looking at what we have now, the existing CFTE, and looking at the RVUs and looking at how can we have that be adjusted and, defined so that people aren't having to do extra clinics to meet the requirements we have, but what we're already doing and, can better do that. The other thing I would bring up is that right now, both at the university, which impacts us, and at Seattle Children's, which impacts us, there is an ongoing efforts with two different consultants to define what clinical FTE actually is. You would think that was easy, but even across the country, we can't agree. People have been working on this at least 5 years that I know of to define what that means. And so both now locally, the university and the hospital are trying to define that. We are deeply involved in that, and we have people on the committee that's looking at it from our department. But, that's going to be real important to how clinical work patient-facing and non-facing, patient-facing is attributed, and that work's ongoing, so I can't tell you what the outcome is going to be, but we're working hard to make sure it's in the favor of the work that we do, rather than hurting us. And then if you look at research funding, of the $253 million total dollars that SCRI has received in total awards over the last year, completely blowing our projections of what would happen, because we also the last 3 years we've increased each time more than we would have thought. Of that, the department is contributing about $200 million to that. The department faculty who work at SCRI. We make up about 65% of the total faculty at the Research Institute, and those people make up probably more than 78% of the total awards now. Last year, that number was 174. So, we keep making these leaps and bounds, even within a really tight and crazy competitive scenario nationally to get funding. Fred Hutch went up as well. Let's see. No, Fred Hutch went down a little bit. I think there's been some transition. They were 10.4 last year, and UW is essentially the same as last year as well. Where the big increase has happened is within recruitments and people being very successful in their grants. And one of the things about that, when the division heads sent me the information on what to focus on, many talked about the grants, but we have $200 million, $240 million. I can't, that would be the whole talk. So I decided not to try to, say, well, this one's better than that one. So I'm not, you won't see that in this talk because we have incredibly amazing research going on, and you can't even do it justice in an hour talk. Maybe one day we should have a whole talk just on that. Other things that we're doing, again, in the midst of all of the challenges we have, we must continue to move forward. We must look forward at what we need to be addressing and what is important in the future. And so we do have committees and initiatives. Dr. Molly Groh is leading our Climate Change Care Committee. And they've been doing work, and I think it comes up again later. The Global Health Collaborative has been in existence for now a few years, and with a team of people leading it, and they've had conferences, and they're also doing work and helping with people who would like to do global health research, and the JEDI Committee, and Sheila Satyanarayana. Hopefully I said it okay, Sheila, is really, I asked her earlier in the year to really look at our department, look at what we need in terms of pediatric environmental health, and see if she can pull together, I don't know if it will be a division in the future, a section or something. We need to do more. We need to have some clinical footprint there and really be thinking ahead about what that means within and what our responsibilities are to really address this clinically, as well as all of her amazing research. Dr. Ndidi Musa is leading our coaching program, and that kicked off. We had her come present at a faculty meeting, and that's really exciting, and hopefully will help our junior and mid-level, and even our coaching faculty over the course of the year. Dr. Amy Trowbridge is leading our PEDS talk, and that's been kicked off, the program that's helping us to be better at communication in many different ways. She talked about that just recently, I think at Grand Rounds last week. And BRIM PEDS, our anti-racism and DEI curriculum that's really focused and on at the division level, is led by 3 of our great people, Doctors Theda Ong, Roberto Montenegro, and Hannibal Person, and that is continuing to be rolled out. We've had some pilots, and the work has gone on to look at the results of the pilots, and we're going to continue to do that work and roll it out further this next coming year. So when we think about the priorities of our department, we really, the leadership sat down and thought, what is a sentence that could describe it and what's important? And what we came up with was mission-driven success through empowered leadership. We wanted that, it was very intentional to say mission-driven. That's the first space that is critical. And, how do we do that? And that's through empowered leadership and within the department, and really helping us to lead through a number of things. And, we have our FY24 objectives, but it's very important to know that we are not somehow driving less on equity, diversity, inclusion, and anti-racism, or belonging, community identity, balanced well-being. We can't complete these objectives without integrating these core goals and values within them. So even within financial sustainability, operational effectiveness, and retention and recruitment, we will incorporate, and it is, everybody's very clear about that, some of our foundational goals that we have. And each of the vice chair units has created strategic plans with all of this in mind. We want to be able to work better, work less, and get the same impact, not work harder and keep pushing and pushing and pushing, and not be as effective as we could be. So we are taking the time to look at how we are working, and we're working with the hospital in particular with that, to look at how we are working, what are our supports, what would be best, so that we can see the patients we need to see. Sometimes we are seeing way more, depending on sometimes we're not seeing as many because we're not as optimized as we should be in our supports and in our way of looking at what we're doing, deciding what only we can do, and focusing primarily on that versus seeing everything, because in order to see everything, we have wait lists, and we miss people that only we can see. So we need to really think about how we're doing our work, who we're doing our work with, and what supports we need to do it the best. And so we're not tiring out and burning out people trying to do their best to meet their mission to care for kids. So this is a transition slide. And I got to go to the blanket ceremony at graduation time last year. It was really beautiful. Jason Dean leads that for the School of Medicine, not just for our department. And next year, if you get a chance, it's really a beautiful, beautiful, positive time and acknowledgement and recognition ceremony on campus. It's great. So this is kicking in his area of DEI, and there are a lot of things here. I can't go through them all because I'm not halfway through the talk. But I do want to highlight. I mentioned launching the Center for Indigenous Health, and a couple of things that we did. I think that are that people have begun to take advantage of is we began offering underrepresented in medicine faculty payment for annual dues for professional affinity groups in the effort to try to increase the retention of people that are underrepresented. We need to help people have supports both within and outside so that they don't feel as isolated as you can feel, especially in a department and in a university and a hospital as big as ours. So this is one of the efforts in terms of retention. Underrepresented people in medicine tend to have a much higher rate of leaving their institutions, and so we have to do some extra very targeted efforts to try to stop that, because we need everybody here to really be the best we can be. And again, with that, we're trying to increase our visibility. So we're in many more places funding and working with the hospital and the university in some instances to be at vendor tables in URM organizations and conferences for students as well as up to faculty. Two big things that are happening I do want to make sure we mention is Jason Dean, Dr. Dean is working with Praxis HR. We're going to do a targeted review of the department's climate for people who are underrepresented. Sometimes that's, and related to DEI, sometimes that's hard in big surveys to do because the numbers are small. So we're, that should be kicking off in the next year to see where we are with that and what more we need to do. And the JEDI committee has a number of areas they're looking at for the next year, having 2 grand round speakers, looking at working with DCOM, the Resident Diversity Committee, and having mentorship pairs, which I think is wonderful, and continuing to have some community and networking events for faculty and trainees. We're also, some of the advocacy things that we've done, faculty have begun to attend more conferences. The more presence we have, whether you come from that particular affinity group or not, the more presence we have in places, the more people know this is a place that's welcoming. And it's really helpful, over the years to really, it's just such a short time between medical school or residency or fellowship, to be in some of these spaces where people are and show them that, yes, at UW Department of Pediatrics, we think this group is important, and we think, we want to have a diverse group here. It's helpful. So we've started to be a little more present in places, and the UW Medicine Equity, Diversity, Inclusion Survey is ongoing well, and that can help us to. It's a little more broad and not as drilled down as our climate survey or the work we're doing, but it's also helpful just to understand trends and how different identities shape our employee experience here at the university. In terms of GME, I just love these pictures. This year the pictures were amazing, and I don't know what they're doing there, but it looks quite interesting with the streamers, and it looks really interesting. So it looks like they had a good time at their intern retreat. Some of the things and accomplishments in education, the Fellows College, I'll start with that one, transitioned didactic sessions for fellows into a half-day in-person workshop to try to increase the number of people that come, and so they went from 1 or 2 fellows in person to about 25 in person. So I think that it seemed like it was a pretty good change. And you can look at these slides later and see if you would like to know some of the details, but I'm going to kind of skip through. At the residency program, I want to make sure people are just, they've done an amazing job and of trying to, again, kind of bring together and unite our faculty and our residents. And the Faculty Supper Club continues. It started last year. It's extremely popular, where about 10 or so residents go over to a faculty member's home, or they take them out to a restaurant and just, have maybe sometimes a certain topic they talk about, but really just a relaxed way to interact and get to know each other and to share ideas and thoughts. And that's been very popular. And I'm sure it will continue. We also, we changed from the word division chief to division head, the executive residents changed their name from being a chief resident to executive resident. So it's important if you kind of missed that. And you didn't know who the executive residents are, that's who they are. They're our leaders of the, from the residency of the pediatric residency program. And we talked about the new people hired, And again, advocacy, our fellows and residents are very, very much involved nationally. These are just a few of the things that they're doing. And I wanted to make sure I highlighted this slide. Our executive residents are extremely grateful. I know you saw the email saying, please, please, please do the interviews. I think they had about 350 interviews this year, and they were able to complete them with people who stepped up and interviewed for our next cohort of interns that were coming in. So they wanted to say thank you. And so here's our amazing executive residents who are really, they're so energized, and they can execute so well. It's a great team to see in action. Now, in research, and when I talk about research, this is from the perspective of the department, not from the perspective, we know that SCRI is a place where many of our people are, but from the perspective of the department, with the new appointment of Dr. Luke Hoffman to be vice chair of research, he is reinitiating the listening tour. There have been a lot of changes since the last time that happened, and so he's really going around and beginning to go around to find out, what are the continued barriers to research. We have new people, as many of you have met Dr. Vittorio Gallo, who's our new Chief Scientific Officer and new Senior Vice President at SCRI and Children's. He's also our faculty member. And so, with new people, all of the major players, both at the university with our new Vice Dean for Research, and here, everybody's new. And so it's a time that's important. We're all very energized to look and relook at things and how agreements have been made over the last 17 years to try to optimize things. So it's real important that Luke is doing this work now. And we continue to have our grant and manuscript writing workshops. Let me go to the next one. Clinical affairs, again, what top and forefront is having a successful PSA transition and really creating a sustainable financial pathway for the department for years to come. The other big thing that is happening is really on Jack Salerno is really helping us transition from all the calls that many of our faculty get on a regular basis that aren't necessarily counted or able to be quantified well, but cause a lot of late nights and a lot of extra hours in non-patient facing clinical work. I think, there were about 14,000 phone calls per year, resulting in 12 hours of unrecognized work per day across the system. So we're trying to move to an e-consult, which it should be completed in the next year. There's been work going on. What's going to happen with that is then it's more measurable, it's documented, billable, and it will expand our clinical capacity, and we can count it in a much better way, so it's not just extra work on the side for many physicians in our department. Academic affairs, again, as I said, we had 105 faculty appointments. We had 56 promotions, and so far I have not been called on one, which is amazing and wonderful. Our faculty are doing fantastic work. And so, so our faculty affairs team is working overtime, making sure that everything, everything is in perfect presentation mode so that everything is smooth for our faculty. And we have worked hard to have a better onboarding within the department. And I think that's getting good reviews. And again, with the changes in reorganization, we were able to have faculty affairs now take over the work with faculty visas, staff appointments, courtesy faculty, promotions. All the faculty affairs team is now doing that work. In well-being, We have, I think one of the biggest thing to really bring up here is we continue to have, this is our third year of division head surveys, which we've, I think the division heads and faculty have found extremely useful. We are, in the second cohort of taking all of our leadership and division heads into a 360 evaluation with coaching attached to that. And that's going well as well. And we're going to continue to do that so that over, probably the course of every 5 years or 3 years, depends how much money we have, we can take people through this formal 360 so that they're always kind of up and aware and able to work on things they would like to work on within their leadership ability. And we will have the annual division head surveys that give you a quick touch in time. That's really important, and I think it's making a difference. We also relaunched the junior, well, it will launch in the new year, the junior faculty mentorship program, and that's been presented on in the past, but that's another exciting area. We continue to have, in terms of branding and communication, remember we have our new logo now, so and you can go on the website, pick it up, and use it, please, as well as our social media. Please remember it's at UW, there's no line there anymore, at UW Pediatrics when you're posting, so that we can tag into it and amplify. So let's get to some of the division highlights. And one of the first ones, I do want to thank all of our Faculty Senate members. We have a number of them right now. These are 2-year terms, and the next election will be next year. So if you're interested in this, please reach out to one of the 7 people here who could tell you more about it. We would love to see a broad participation and people submitting to be elected for the next year. This past year, they've been one of the big things they worked on is the getting through the approval for the professor of clinical practice. Now, that could be assistant associate, but the way they have named it is, just for clarity, is professor of clinical practice, which many people who are in the clinician pathways in the School of Medicine or ours, academic clinician, will probably over time be moved to the professor of clinical practice, which has longer than a year-to-year service contract, and there's voting ability. It'll be a nicer space to be in, but right now what's happening is the rules around that and how people transition into it, how people are brought into it are being made, so it's not available yet. But this Senate group is are some of the people that helped that to come to be. We have many different faculty on many different committees, and student admissions, student progress committee, committee on women, and one Hannibal Person took over this past year being the chair of the Committee on Minority Faculty Development, and the Education Quality Improvement, Strategic Planning Committee. All these committees actually have a lot of work associated with them, so thank you for your service. We were really excited. It's quite phenomenal and unusual to have 2 people elected to the National Academy of Medicine this year, and that's just it's unheard of, and it's so exciting to see Dr. Tamani Coker as well as Dr. Ali Rawani Rabar. He is an affiliate faculty. He's also in the School of Public Health. And so both of them were named to the Academy this year, and we highly congratulate them. Again, we had one of our high numbers of people elected to APS this past year, the American Pediatric Society. It used to be easy to say it's the honorific society for the pediatric field, but we actually do work in APS now, so it's more than honorific, and we need people to join and help do some of the advocacy and career work that they're trying to champion as well. So congratulations. And we had 7 people elected to SPR, the Society for Pediatric Research. I believe there are probably more people that should be elected to this. So please, if you're doing research, you're not in SPR, please look at, click the link, look at the requirements for that, because I believe there are even more people that should be in this. This is a great networking, leadership building, research, collaborating organization that is very good to help jumpstart careers. And it used to be more junior, but they've actually now extended so that, you could be more seasoned and still be in SPR. National impact, we have so much. It was almost impossible to put this together, but I do think it's important you just get a taste of all the things that are happening and the things that our faculty are doing. Dr. Tarnay Shafi's name is a typo. I thought I got all those out. Her last name is not spelled correctly, so I apologize for that. But she was elected to the AAP Committee on Adolescence. Dr. Greg Redding was in Korea, giving a invited lecture. Let's see. Yeah, adolescent medicine was reawarded the Leadership Education and Adolescent Health grant. It's only one of now 8 nationally, and it really helps set up outstanding training for 5 different disciplines. We've had, and Dr. Denise Dzinski was elected. She's in our bioethics division, and she was elected as a fellow of the Hastings Center. I think we have a couple of people now that are in the Hastings Center, which is quite an honor. We have many different people doing amazing work in different organizations. And I thought this is great. Dr. Craig Jackson was named Vital Talk Distinguished Faculty. So we've got to talk to him because he must know how to talk well to everybody. And Dr. Indy Trehan is a co-chair. He does a lot of things. I just picked one. Co-chair of WHO and UNICEF Tech Advisory Group on Wasting and Nutritional Edema. He does a number of things internationally, which are quite impressive, but I wanted to just pull one out. Dr. Rhea Kohler is also working with the World Health Organization and a number of other groups on neglected tropical diseases. So, there's impacts that are not just national, but they're international. And we have a number of people who are chairing and co-chairing different national groups. Local impact, again, I could have probably had 10 slides on this, but I just wanted to give you a taste again of what people are doing. One new, just off the press, we were real excited. Dr. Casey Lyon agreed to be our research director for the Center for Diversity and Health Equity at Children's. That was a national search, and she was our best candidate, and she just said yes this week. So it hasn't been announced yet, but I'm announcing it now. So we're very excited about that. And you see there's a number of different people. Top doctors, again, we have just so many people that are recognized within the community as being a top doctor, and it crosses so many of most of our divisions. So congratulations to you. If I have forgotten somebody, if we try our best to get everybody in different sections, please let us know, because we don't want to. Nothing is intentional. We just sometimes, we have a lot of faculty, and sometimes I hear about things from division heads, and sometimes, we don't. But I think we got this, and this is pretty exciting. Different awards people have. If you see up at the top the pictures of Dr. Fred Rivara and Dr. Michelle Terry, they're in the front. You see Dr. Bruder Stapleton and Cora, and Yolanda Evans, Dr. Evans in the back, Dr. Cora Bruner in the back. But that was at the King County Medical Society Excellence in Medicine Awards, where both Dr. Rivera got a Lifetime Achievement Award, and Dr. Michelle Terry, who's sitting here in the audience today, got the Reducing Health Disparities Award. So that was pretty exciting. A number of people attended, and I'm really proud of them. And Dr. Cora Bruner got a national award from the Academy of Pediatrics, the Adele Hoffman Award, that's given to a top adolescent medicine person in the country. So that was exciting. you can see all of these. Let's see, yeah, Dr. Jerry Zimmerman, I thought this was cool, Master of Critical Care Medicine from the Society of Critical Care Medicine, ACCM. That was kind of cool. And Dr. Molly Groh got the F. Bruder Stapleton Award for Excellence and Innovation in Medical Education from the residents in 2023. So there's a number of things that I want you to see and hear about. Some of our other UW awards, Scott Babler, and you see him here with his cool award, got the Partner in Safety Award at UW, and Yujiro Okiyama got the 2023 Distinguished Staff Award nominee. He was nominated, which is also huge, and so you see them there. Dr. Jason Dean got the 2023 Martin Luther King Community Service Award, and Dr. Catherine Carr got the UW Department of Environmental and Occupational Health Sciences Outstanding Faculty Mentor. So we have a number of people who are noted for their work. And again, we have a number of different people who've been doing innovative things, notable achievements, in Ghana with the Craniofacial Center. They're changing lives. And there with their cleft palate and surgeries. I think they had 4 different countries come for their trainings and surgeries and all the things they did while they were there. It's pretty exciting. So, you can look here and just see we are really standing out in every way possible with the new gene therapies, first in USA to prescribe a new FDA enzyme, and there's a lot going on. Community involvement, I think this is always really important. There's definitely, with Nivian Blondet working at the United Network for Organ Sharing, Dr. Jarrett Scarlett being on the financial advisory board in Everett School District. I know that must be fun. But doing things above and beyond, what you have to do, and Dr. Doug Dikema being the cross-country track coach. I remember when my daughter was in track. That's a hard job at Inglemoor. Doing this work on top of what you're already doing is quite amazing. And I get to hear personally from McKenna Foe about her board membership on the Seattle Young Professionals of the American Cancer Society Board and all the amazing energy she's bringing that. It's quite commendable. So thank you for being real people in the community. And there were more. That's some of the ones I just decided to put on the slide. Lots of changes and transitions that we have had both within staff and faculty. One I would highlight again is Dr. Jason Debley starting the new Center on Respiratory and Biology, their therapeutics, in our new center. It's pretty hard to create a center. Many people would like to have a center. This is the first one we've done in quite a long time. He's the interim center director. He also helped create it with a number of people. And let me see. I think I'm going to keep going. I'm almost out of time. And then neonatology is just recruiting like crazy. They're going to be growing, and they're trying to keep up with the growth. We recruited our first senior nurse scientist to SCRI, and in our department, Dr. Teresa Ward. That was pretty exciting. It's something that's been wished for at least a decade. So it's pretty exciting to see it actually come to be. Dr. Mate de la Morena is helping develop our department and hospital allergy service in immunology, working with pulmonology as well, so that's pretty exciting. A lot of things going on. Advocacy at the state and national level continues to happen. These are some of the few things I saw on the reports of people and what they're doing, but there are so many people, residents, fellows as well, that are being really strong advocates at the national and local level. There was one question that said, is there anything that you really want people to know? And many of the things I was able to incorporate, but these are some things I thought were cool that I couldn't easily incorporate in the other slides, but I just thought it was really cool, given that question, Dr. Chin really talked about how she had worked with a Peruvian doctor who was kind of giving up on her dream to be a pediatrician, and she, through mentoring and help, she was able to work with her, and the doctor was matched at DC National in pediatrics, so she thought that was pretty cool that she was able to help her. We still, the emergency medicine group is doing just unspeakable work to try to stay above water with the number of mental health challenges, the space challenges, the bed challenges, and trying to manage all of that and improve the experience of people who are people of color in the emergency room. They have done some great work on language. They've done a lot of that, a lot of crazy work in a crazy, unpredictable situation, and they've done it just amazingly. So it was good to bring that up. And again, Dr. Klein was able to, have the PCARN HRSA grant funded, and she continues to lead that amazingly. And developmental medicine, whenever I go anywhere, everybody's looking for somebody to do developmental medicine. Dan Doherty and that team has recruited 6 new providers. It's incredible. And two scientists to that group, as well as Dr. Dorota Sapoznik, who is an amazing person who's been a vice chair and is coming here to be director of innovation and really look again at how they're doing their work and how they can do it better. With 50%, only 50% matching in the country, they were able to match both of their slots with their top choices of fellows. So they're really doing an amazing job. So thank you. Retirement, we've had a number, it's a normal, natural thing, but we've had a number of people who've really dedicated their work, changed the landscape for children's health, and really were great faculty members during their time here. And here's a list of the people who retired in 2023. Upcoming retirements I wanted to put on here because these 2 are in January. So if you didn't know, say hello and thank you to Dr. Ron Gibson and Dr. Karen Yanakawa, both of whom will be formally retiring in January. And now I'm pretty much done. I just will show you some pictures. If you have one question, maybe, I don't know. I can do these. These are just some cool pictures from the National AAP conference. Pictures from the pediatric residents. I like these. I don't know what they were doing there with the blankets, but that's kind of cool. There's a lot of fun pictures. Yeah, oh, okay. There was just an article about swaddling. So those are residents. This is a really cool picture to me with the Northern Lights up in Alaska. That's just incredible experiences people have. Pinnacle Peak. And one of the things I think is cool is that for people who didn't want to go up the mountain, not everybody is ready to trek up the mountain. There was another activity this year that the people who didn't want to do that. So I think just about everybody got involved in a challenging and bonding exercise during the intern time. Some of our health equity research early career faculty scientist cohort that Brian Salins and Tamani are really helping to lead. And you see Anthony Bowie, who is one of our executive residents, who's in that group now as a faculty member. And this is I think that's almost the last picture from our summer August celebration at the Burke Museum. That was a lot of fun. And that's my last slide, just our logo. So.
Perfect timing. We'll have to have you back in the middle of the year so you can talk some more. But thank you so much for all the work that you do, Dr. Walker-Harding. And thanks to all our Grand Rounds participants in the room and all the people that are online. We really appreciate all of your participation, and we'll see you all in 2024. Thank you.